Hello, everyone. I'm Dr. Mohammed Hamza, and today in our podcast we have a special guest, Dr. Zlatina. How are you, doctor?
I'm fine, thank you. How are you?
I'm good. I'm good. Thank you very much. As I understand, doctor, you are a very amazing dermatologist in here in our hospital, Elysee.
Oh, thank you.
I've heard a lot of good things about you, and I just want to start by how did the journey started regarding your professional?
Well, I can say that it started when I was 4 or 5 years old, when all my dolls were injected all the time.
Wow.
Yes, this was the love of my life to do injections. Of course, going into aesthetic dermatologist happened years later. Uh, Here in this country, where I have been for more than 30 years now.
Wow, amazing.
And although I was dealing with aesthetic procedures from the beginning, the real aesthetics that we know today with lasers, with fillers, with Botox, they started to grow after 1998 in this country. So that's when I had no hesitations, and I started to do these procedures.
Oh, wonderful.
I indulged myself into
Yeah.
aesthetic dermatology mainly.
Oh, okay. That's wonderful. And the way you started here in UAE, was it a challenge to you, or it was easy?
It was as if it was meant to be.
Yes, yes.
Yes, it was. Of course, it was a challenge to establish myself. You know, every one of us has to go through uh, licensing
Yes, true,
and
true.
so on. But once this step was taken and passed, things were rolling out.
Yes, very easy. Yeah, yeah, true. Here in UAE, I can see that there is many dermatologists, and aesthetic medicine is growing so fast that many people nowadays uh, feel like it's something trendy, as we can say, or maybe something very natural, because many of the doctors now have it in a very natural way, and some of them, of course, ups and downs, they have minimal results, or maybe very bad results.
As
What do
I
you think?
said, it's something that has to be inside you. I have a colleague who he's also dermatologist. He started with aesthetic procedures, but he decided it's not for him and continued in dermatology. Unfortunately, there are many um, not so competent people that are trying, not trained enough. I am not saying that, but it is not only the training. It's like the surgery. I'm telling very often my patients that this is the work they have to appreciate, not the product, or it's the work. Like the same way they go to a surgeon and they choose the best one for their operation, they have to choose the best performer to do the procedures on them.
Yes, yes, yes. That's true. That's very true. And is there any maybe cautions that a patient should maybe have, or do before any injectables in general, or taking something before?
There are, of course, precautions and warnings. Basically, every company that produces manufactures the fillers, they are advising that like 10 days before, patients should not take any anticoagulants, which is so difficult to manage for a procedure like that, because many of the patients, I wouldn't say most, but they take aspirin daily for certain health conditions. So you cannot tell them to stop 10 days before. So everything remains to the hand, the touch.
Yes.
I can say that I don't make a difference between patients who take anticoagulants and those who don't. It's the touch.
Yes, that's true. The touch, and as before, one surgeon told me, if you want to be successful in your career, you have to have heart of a lion, fingers of a lady. That's what they say.
Well, for the surgery, you need a little bit stronger hands than for aesthetic dermatology. So I don't know.
Yes,
He knows
yes.
better if he was a surgeon.
Yes, yes, true.
So I advise them, those who have very sensitive skin that bruise easily, I advise them to start 2-3 days before arnica,
Okay,
pellets,
okay.
arnica, and to continue for a few days after the procedure. This reduces swelling and bruising. But that's it.
Oh, okay, that's good. And is there any something that you remember, that a case, for example, was remember, and it was, for example, very disaster or maybe difficult, that maybe we can make an example that to prevent, or through your career, of course everyone had many cases through.
I can thank God that I haven't met with big disasters. Actually, the disasters are in the minds of the patients. They don't listen, or they immediately forget what you have told them after the procedure. I tell everybody after fillers that there will be swelling. There will be swelling, which is normal. With some kind of fillers, of course, it depends what we choose to do. So there will be swelling, and it will subside naturally in 3-4 days. But when they see them swollen, they start calling, they start being anxious. You have to you have to calm them down. You have to talk to them. They want immediate everything to disappear. So I would say that these are most of my excitements after some of the procedures. So. Of course, there are cases when the result doesn't meet the patient expectations. They have expected too much, and we have some disagreement. But more or less, I would say that through the years, I have continued to work with the most faithful patients that believe in me. And many of them are telling me that they cannot think of going to somebody else.
Yes, that's royal patience, which is amazing. If someone wants to build their reputation and build his career, it's always challenging. But when they reach, it will be a beginning of a new era or anything.
Yes. You know that now I have the daughters of the mothers that were brides, like
Yeah.
at the time I was starting.
Wow.
And now their daughters have daughters, and so there are generations, two or three generations that are going through the years. They have followed me. And we have very good relationship.
That's wonderful. That's what keeps a very good hope in all the aesthetic medicine, and I think it's very beautiful. Patients feel like it's we feel like they are family. They are not like
Yes,
patients,
yes.
like they are family. And if, of course, if we want to make the looks very more naturally, because social media is filled with very, you know,
Horrifying things
horrifying and
sometimes.
weird stuff. So how can we make it more natural?
Well, I can say my signature is the natural look. So uh, that's what my patients appreciate, and that's which patients I have kept as patients. Those who want to look naturally. Uh, I have always been telling my patients, you don't want when somebody look at you to tell you, oh, she looks younger than her age. That means they can recognize your age, and they just appreciate that you are doing something and you are keeping yourself. I'm telling them that they should look in a way that nobody can recognize their age, that they should really look young, years below their age. And something that I'm very, very happy after the trend of these big, ugly lips.
Yes.
Now, since last year, when in July I came back from one conference in London, and I brought actually from 2, 3 presentations, I combined one procedure. I started calling it morning lips. It's totally different technique for injecting the lips, and it gives such a natural look, and it just enhances the natural beauty of the lips that from that time till now I haven't done any other technique. Everybody comes now it is somehow the word has spread, and patients come and ask for the morning lips. So I'm so happy that I started something in Abu Dhabi, maybe even in the Gulf area. So it's really, really very natural and very nice. And for the other procedures also, I am not very extensive with the amount of the fillers that I use. I try to follow the natural shape, the natural contours. I like to sculpt the faces.
Yes, yes, yes. Yes, let's take one of the special cases. For example, as I saw once before in the social media, some pictures I've seen, like the face in the face. Some patients has one eyebrow is higher than the other, and a little bit asymmetry. So how can we fix these kind of
Usually this happens after Botox injection of botulinum toxin, and it's very easily fixable. The asymmetry when one eyebrow is higher than the other. It's very easy to be fixed with 2, 3 units of the product. The bigger problem is there is drooping of the eyelid. This is more difficult to fix. So asymmetry can be fixed easily. They have just to go back to their doctor, or if they have lost trust in the performer, they can go to another doctor that they trust more. It can be fixed. Usually, I always tell my patients after botulinum toxin procedure, if after 1 week you see something there is asymmetry, you just come back to fix it, because even if you are very precise, sometimes if there is a drop of blood coming out with the injection, this tiny amount of product might come out with the blood, and because we don't know if this has happened or not, we cannot repeat the same point of injection. So we have to wait until the botulinum toxin, the toxin takes place. Usually with some of the Botox, it takes a week, with others 10 days. So according to which product has been used, the doctor has to advise the patient to come accordingly.
Yes, and always there is touch-ups and fixes,
Yes.
and so
But not touch up after 2 months, like sometimes I have. Usually the excuse is that I have been away, they couldn't come, but I am here every month for at least 2 weeks. So if really there is need of touch up,
it should be very
2-3 weeks is the maximum, not 2 months after.
yes, yes. Of course, botulinum toxin is making us more younger these days.
Not only that, there are some studies, I haven't gone into deep details to know how scientifically correct they are, but it is accepted now that the toxin stimulates the production of the hormone of happiness, the serotonin.
Oh,
So yes, people feel happier. See, I have some patients that they need a lot of things on the face, but they come for Botox only. For me, it doesn't make any difference if you have or don't have lines on the forehead and you are droopy or you have circles under the. But no, they want only Botox. That's how they call it. They want only this treatment of botulinum toxin. So obviously there is some truth in.
that's amazing. So instead of eating a banana,
You can,
which is rich and have Botox here.
toxin treatment. Yes.
That's good. I think I will be the first to come for you, doctor. You see, I'm full of lines in my forehead. That's great. So it's very unique and nice to take the aesthetic medicine as a professional career, and very amazing field. It's very interesting.
You know, when I was starting my specialization in dermatology in my country, the doctor they assigned me to work with, she asked me what you want to go, what subspecialty you want to take. And I said cosmetology. At that time, cosmetology was the part of dermatology that was dealing with acne, with rosacea, with these things. There were no the aesthetic procedures that we were, this was many years ago. So she told me, don't tell that to the professor because it will, he will send you to mycology. Don't tell him. So there are people that were fond of cosmetology and some they were not considering it something serious. But for me, it's all, I have done some sculpting, some painting, so it's really, for me, it's art.
Yes, 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 and it's always the informations of the, and it's always new.
Yes.
There is always studies
Often
and
when I travel, I attend conferences, I attend workshops, trainings. So I never consider myself that I have reached place where I don't need to learn something new. And although when I attend these big conferences, mostly now doctors of my age and younger, they are the ones that are presenting and teaching the doctors that are starting now. Still, you can catch tips and implement them in your practice. So I don't think that it's waste of time and money to go and attend those events.
yes, wow. So, doctor, if I want to ask you, what is the perfect? How can we describe the perfect smile and the lip shape?
We cannot. When I do lips, I have to evaluate a few things. First, when the patient smiles very broadly, if gums are showing, but usually the people know about that. So they tell me, doctor, I want my lips done, but I also want to take care of you to take care of the gummy smile.
So they want or the gum smile
They
to
don't
appear.
want it. They don't want the gums to appear when they are smiling. Yes. So otherwise, for the shape of the lips, I am trying to follow the natural. There are very difficult lips. There are people with practically without lips. It's so difficult to do such to work on such lips and to give them really good shape. But with will and efforts from both sides, because it's not only the practitioner job to make it work. It's also patience, understanding that it will not happen with one visit to the doctor. Probably there will be need for 2 or 3, sometimes 4 visits in certain period of time that the doctor will advise, and this is also manageable. It's more difficult to work on lips of men because it should be so subtle that nobody will recognize that it has been done. But also there are many women that don't want the mother to notice or the husband to notice. So now we have achieved this with the morning lips technique.
Oh, the new technique.
Minimum swelling, of course, bruise cannot be guaranteed that there will be no bruise. But minimum swelling, the most natural look, and no lumps appearing on the lips because of the technique of the injection. So everybody has been like 100% happy.
Yes, yes, yes.
Because there was technique like Russian lips, like I don't know what other.
I've heard of something called the Cleopatra face. Is that some
No, it is not Cleopatra face. It's Nefertiti lift.
Nefertiti?
And it is a procedure done with botulinum toxin to define the jawline when there is some starting of sagging, or for prevention of the sagging, because actually we address the higher parts of the neck muscle, the platysma, which reaches the lower part of the face, the jawline. So when we relax this part of the muscle, it somehow gives support to the sagging part of the face. And it is not surgery. It cannot achieve the result
non-surgical
of surgery, but it is effective. But nowadays, we go even further. We can do full facelift with botulinum toxin. Even now, there is one technique that goes through all the hairline from the back here. So there is some lifting of the neck and the full face. But of course, the key to everything that is that we have to very carefully choose the cases for the different procedure, because not every procedure works on everybody. So we don't want unhappy patients if we haven't advised them properly what they need and what will have effect on their face.
Yes, this is true. Very importantly, not every procedure fits the patient. There is certain
if
criteria.
There is a heavy face.
Yeah.
Of course, Botox will not work.
Yeah. Yes.
We cannot, because we are limited with the amount of botulinum toxin we can inject. We cannot if we overdose, there will be side effects. So we have to be careful. Now, the other trend that was years ago, and still some patients have been advised, and this Texas look, which is not suitable for women at all. I have seen in my practice 2 or 3 women who have very, very narrow face in the lower jaw, and they will benefit of mild filler injection in this part. But I have cases that full face, and they come and they ask for Texas lift. I am a Texas face. I am refusing to do sometimes procedures that I see they will not fit.
Because it will not harm them more only. It will be
First, don't harm.
it will not
You
harm.
know, this is as doctors.
Yes.
At least in my country, before receiving our doctor's certificates, diplomas, we have given an oath.
Yes.
First, do not
Yes, we
harm.
all did. Yes.
So that's always in my mind when, even in the aesthetic medicine, when I approach every case individually.
Yes, that's true. Because everyone will need something, but we have to choose what's best for the patient. If you don't need it, you don't have to do it.
Exactly.
You don't have to do it. Maybe you will do something else that will benefit the other criteria.
And
the other.
actually, I think I have gained the trust of my patients that when I say they need something, they really need it. Because very often they are asking me for something and I say, you don't need it.
Yes. That's the most important thing. And wow, this is amazing journey for you, doctor. Through the experience that you have, I think it's.
I miss the dermatology a little bit, but not that much.
Okay, it's more difficult, the path of dermatology.
No, but there is no imagination in the general dermatology.
It's a straightforward
Yes,
case.
yes.
Yes. If you have this, you do this, and
Yes.
okay. Wow, it's a very big field. For most of doctors, they feel like it's a little bit challenging, the aesthetic medicine, because
It should be, and that's why not everybody should go for it. For example, like in my country, there are beauticians in the salons that are doing toxin and fillers injection. Here, I hear from patients that there are some visiting doctors that stay in a hotel and they do procedures there, or they go to the houses and they do procedures. They bring their products from nobody knows where, and still there are patients that are willing to go for cheap treatment, and they are suffering after.
yes, it's a disaster. It will be very bad results, and it needs at least that you visit the doctor regularly, and you have to continue your treatment, and not to just inject anywhere or everywhere, and then you. Yes, that's true. That's true. I apologize that I didn't ask you where your country from, because you keep mentioning your
I'm
country.
from Bulgaria.
Oh, Bulgaria. Oh, that's amazing. That's amazing. It's very different in approach in the aesthetic world in Bulgaria. It's different from here, or
No,
it's
I wouldn't
as same.
say that. Here, we are more advanced in the newest technology of machines,
Oh, okay.
because some of them are very expensive, and they will go there a little bit later. But of course, some different products are used because it is a matter of what is registered in each country. But no, and in Bulgaria, since long time ago, even when I was a child, uh, of course there was not aesthetic medicine at that time, but the women used to take care of themselves. They will visit their beautician every week for massage, for like some pampering. So there is a tradition for the women to take care, even uh, like regular working women. They will do it.
Oh, okay. Wow. Wow. Well, maybe we.
But here in this country, the women also are very concerned about the way they look, which is something very, very admirable.
Mm.
Yeah,
What about men, doctor? What do you think? In men, do they need defined jaw lines? Do they need lifting like women, or
There
it's
are
different?
doctors that work with a lot of men. I have few male patients. Those are mainly husbands of my lady patients. I cannot say that I have too many males, and there are specifics in the approach to the men, because they really should look as if they have not done anything, but they will look better. So there are specifics. You cannot approach
The male patient
female
as the male.
face the same way like the male. In everything, in the botulinum toxin, in the fillers, it's totally different. This Texas look, yes, it looks good on Brad Pitt has it.
Oh yes, yes, yes. I heard that there is something, but I didn't think it's it's the
This
Texas.
square
Yeah.
jawline that may give some like uh, maleness.
Oh, okay.
It increases the maleness in a man.
And the perfect chin, as it should be,
The square,
little
it is part
square.
of this
Yes, yes,
procedure.
yes, yes.
Yes.
Oh, wow. So, talking about fillers and Botox, what do you think of other techniques that can give us very natural and nice face? Like, for example, lasers, dermapen. I've heard a lot
My
of
first
these.
love are the threads.
Threads, yes, threads as
The
well.
most natural look, the fastest lifting effect, it's with threads. Unfortunately, when I tell threads to the patient, they say, no, I don't want threads. And this is something, of course, in not competent hands, the threads will not have the desired effect, or maybe there will be some side effects. But with the trained professional, the threads will give amazing result. But it should be understood that it's not one-time procedure. It's a process, and you have to follow up. You have to do to come to the visits that the doctor has advised you to, because it cannot be. It builds up with time. If for the first 1-2 years you have to come, for example, every 6 months to do the procedure, then the third year it will be once a year. Later, maybe once every 2 years. But the threads are the most natural. If a plastic surgeon hears this, they will, of course,
Yes, yes.
deny, because 10 or maybe more than 10, maybe 12 years ago, I was sitting for a coffee with a plastic surgeon in my country. And he told me he doesn't believe in threads, and he advised me to have facelift. Now, I will never think of having facelift, knowing the type of my skin, which is very thick, so facelift will do nothing. I maintain myself with threads, so I believe in them and I advise. Actually, I never advise a patient to do something which I haven't tried on myself. Really? Yes. And you asked about machines. I believe the number one machine I believe in is the microneedling radio frequency, and from them the Morpheus 8. Why? Because it is the only, for the moment on the market, bipolar radio frequency, which means that we deliver the radio frequency on the surface of the skin and from the tip of the needle. And this treats the full depth of the skin from the surface to the end of the needle. So it treats all this part. The monopolar machines, they emit only from the tip of the needle. So some of them, the power goes from tip to tip, so it is like one straight line at the depth of the needle, but they cannot treat the
deep
full
dermis,
depth, the full layer that we have, the needle reaches. So it's not only because we have this machine. We chose this machine to have in our hospital because it's the best.
Yes, and it's radio frequency Morpheus. It's that's what's.
It's microneedling radio frequency, bipolar microneedling radio frequency.
Oh, okay. Wow. And how frequent do someone need this?
When somebody starts, they have to do at least 3 sessions every 6 to 8 weeks between, because this is the time of the new collagen that is produced, because we stimulate the collagen, the elastin, the vascularization, some new blood supply, to bring blood supply to the skin. Usually I advise like that. I advise the 4th procedure to be after 3 months from the last one, and then maintenance every 6 months.
And it will
so
change.
The 5th will be 6 months after the 4th, and then they see difference from the first time.
Wow,
it's
really?
When it is done properly, with proper technique, it is the results are amazing.
Wow, wow. And the effect will last longer.
If they maintain every 6 months, yes, because the skin will be very it makes the skin stronger, thicker by the stimulation of the collagen and elastin. So whatever usually if I want to do fillers, threads for somebody, I check the type of skin, the quality of the skin, and if the skin is very thin, very lifeless, saggy, I advise first the course of Morpheus and then threads. Yes, that's why sometimes there is no result from the threads, because when we inject the threads, it has to catch something.
Oh yes,
you
yes,
need
yes.
The tissue to be strong, so it can
hold
and
stay. The thread
because
itself,
it
has cogs. Yes. Okay.
The other reason that patients are dissatisfied and is that every company that is selling threads, they want to sell more and more, so they sell to everybody. Their purpose is to have more sales. So again, training is very, very important. If somebody starts doing threads without training, of course there will be no good results.
Yes. It should be in good hands, and the best quality of threads. I suppose.
Well, yes. Of course, we have to go for good quality, so we have to know what threads to choose. And actually, we started with PDO threads. These are the threads that last around 6 months. They dissolve, like the fillers dissolve, but they stimulate collagen. Then there were different PLA threads that were they were advertised as longer lasting, 1 year, 1.5 years, 2 years, and we started working with those threads. But what I found in the practice, even with me, because as I said, for my face, I trust the threads completely and I'm doing it regularly. Those threads, they stay. Until recently, I could feel a thread, but the result disappears. And when the thread is still there, you cannot do another procedure because you feel difficulty. You cannot overpass this existing thread. So I went back to the PDO threads, which can be done every 6 months, 6 to 8 months. We know that they are not anymore in the skin because the lifting effect is the same with the PDO and it will last the same time.
Oh, okay, and it will not be seen if.
It's not seen. You cannot see the thread unless it is not done properly.
Yes,
you
yes, yes, of
but
course.
you can feel it in some places where it has passed more superficially, or the skin is very thin, and this area, or there is bone underneath. Yes, you can feel it, and you can see it. Of course, in such areas you can see it, but usually they are hidden. It will be disaster if you can
Of
see
course,
it on
yes,
the face.
yes, of course, of course.
Yes.
As I understood, there is types of threads that will rejuvenate your face instead of lifting, of course.
Yes, the so-called, they call them the mesothreads. These are very, very thin, like hair thin threads that by stimulating the collagen, they can even tighten the skin, because if you know how to inject them very close to one another, like between each other, they create collagen bridges. And with the studies, they show that if initially the threads have been injected, like let's say 3-4 millimeter from each other, after 2 or 3 months, if you make X-ray or ultrasound, most probably, there will be less distance between the threads. That means that these collagen bridges have
built between the
built it.
threads.
Yeah, they have tightened the skin. But to have really visible effect with those threads, you need probably 200 threads on the face.
Oh.
So nobody
Yes,
goes
yes.
for this anymore.
That
They
would
don't
be
have
too
the
much.
patience.
Yes, yeah.
We used to do it, but not anymore. Yeah. We have now so many other things for rejuvenating, like the different boosters, the
Yes, yeah.
collagen stimulating products that are we inject them. It's easy for the patient, easy for the doctor, and they have also very good collagen producing effect.
Oh, that's great. That's great. Well, doctor, it was very nice, amazing to see you and to meet you here today. I don't know if you want to add any for our patients, if you want to add any advice.
There are so many advices that can be given, and one of them is that we shouldn't take care only for the face. We should live healthier. So from inside, the beauty have to be brought from inside out.
Yes, that's true.
And then everything that we do from outside, it will just add It
Yes,
will be in addition
yes.
to that.
Yes, true, true, true.
So I don't know what else, but maybe another time.
Yes, exactly, maybe. So amazing. Thank you guys very much. And we are here at Elysee Hospital. I think there will be a link drop down in the broadcast, and we welcome you here to have a beautiful session with our doctor Zlatina, and see you here soon. Thank you very much. Thank you, doctor.